We'd like to welcome all of you to our Learning for Life presentation today. I will be your moderator. My name is Donnell Ivy, and we have three wonderful speakers here to talk to you today about sickle cell disease transition across the lifespan. We have Dr. Amy Liu, who's a pediatric hematologist with Children's Hospital at London Health Center, and she will be giving a presentation about the importance of considering transition, particularly for individuals with sickle cell disease as they move through those stages in life. We want to make sure that individuals with sickle cell disease can stay healthy as they go from high school to college or work, and then from home to their new homes as they transition. We're also fortunate to have Dr. Lance Archer, who's a clinical psychologist, and also, if I may mention, an individual living with sickle cell disease. He'll be talking to us about that transition process and giving hopefully some of the lessons he learned as he transitioned. He's currently working at the West Niagara Psychology Center in Beamsville, Ontario. And then we're very fortunate to have Sarah Rashid, who's a social worker, and she'll talk about the programs that they have at McMaster's University that really helps individuals with sickle cell disease to transition. Now, we're gonna have the welcome and acknowledgments. I will go over a couple of housekeeping rules, and then we'll have the panel presentations by our three panelists. We will ask that you type any questions you may have in the chat, and hold your questions until the very end, after all of the presentations are complete. And then we'll be able to address your questions. So if you have any questions, please type them into the chat as the presentations are going along, and we'll be able to address them all at once during our question and answer period. And then at the end, we'll have closing remarks, and then we'll end for the day. Now, just to provide a little bit of logistics, so as I mentioned, oops, so this session will be recorded so that we can make it available for other attendees that weren't able to be with us today. And as I mentioned, if you have any questions, we will ask that you enter those questions into the chat feature so that we can then ask the questions at a later point in our presentation. Now, I want to give a land acknowledgement. We're grateful for the opportunity to gather, though virtually, on this land, and we thank the generations of indigenous people who have taken care of this land long before other nation groups came. In particular, we acknowledge the traditional territories of the Abwe and Anishinaabe and the Mississaugas of the New Credit, whose territory is covered by the Upper Canada Treaties. We also recognize the contributions of the Métis, Inuit, First Nations, and other indigenous people who have made in shaping and strengthening this province and this country as a whole. We also need to continually educate ourselves about the colonial history of this country and understand how the wrongdoings of the past still impact the present and the future. I encourage everyone at this session to actively seek information and to take action. So now at this time, I'm happy to introduce Dr. Amy Liu. As I mentioned, she's a pediatric hematologist, and she'll give us a presentation about transitioning and the importance of transitioning for individuals with sickle cell disease. So Dr. Liu, I'll turn it over to you if you can share your slides.
Well, thanks so much. Thank you for the invitation to speak, and thank you to everyone who's joined today. I'm really excited and fingers crossed that the share screen goes well. Oh.
Let me see. Oh, let me stop sharing. That might be what needs to happen. Great. Can you share now?
I hope so.
Yes.
I think, are you all seeing some slides?
Yes.
Okay. And are you all seeing a slideshow mode now?
No, it's okay. Now
No.
it is. Yes.
Okay. Is it it's the front slide of a
Yes.
slide
It's the
and you
title.
aren't bothered by my Zoom window. Okay, perfect. Always got to check the technological part of it, and definitely someone speak up if my mic cuts out or anything. But I thank you again for this lovely invitation to speak about really just one minor part and sort of my perspective as a pediatric hematologist on transition, which is so important. And I'm really looking forward to the other perspectives being shared today as well. As Anil mentioned, I work at the Children's Hospital in London, Ontario, and so on the pediatric side of the lifespan hemoglobinopathy program that we've got. I've got no conflicts of interest to declare. I don't have many objectives other than to just review some common topics that come up whenever we talk about transition in relation to the care of people with sickle cell disease, and to identify some key elements of transition that we keep in mind when we consider supporting the care of these young people. And so many of you are likely very familiar with what we mean by transition, but I thought I would start with some definitions just either as a refresher or to give us some shared terminology. As many of you know, lots of healthcare is divided into pediatric healthcare and then adult healthcare, and that switch happens a little bit at different ages depending on the jurisdiction, but often around age 18. And so we talk about transition as one definition that I find quite helpful to think about this concept is the purposeful and planned process of moving from pediatric to adult care services, beginning in adolescence and continuing into early adulthood. So when we think about young people with chronic diseases, including sickle cell disease, but this is a concept of transition that lots of pediatric specialists think about in other diseases as well. There's always a really intentional plan to ensure that young people, when they're moving from pediatric care to adult care, that transition happens as successfully as possible. And as you can see from this definition, that's not a one-time motion. It's a process that begins really early on and continues into early adulthood. And I'll just contrast that with the concept of transfer, which is the moment, the one-time event during the process of transition where the responsibility for care shifts from a pediatric to an adult care provider or team. So transition is the efforts to make sure that all the moments surrounding this transfer are as successful as possible and continue to support young people as they go ahead in their lives. And so I've already alluded to, certainly as healthcare providers, we think about this deeply in relation to the movement from the pediatric healthcare system to the adult healthcare system, of which there often are some differences. In pediatrics, we're fortunate, we're built to support and really provide more family-focused care because young people are typically coming with family and family units and extended supports as it makes sense for the care of children and adolescents. This is in contrast, though, to adult care, which tends to be more individual and patient-focused, again, reflecting a more independent, autonomous population. But those shifts can be different, and those shifts sometimes can be objective, such as a shift in the geographic location of the care. There's also some differences in how healthcare providers have expectations of their patients in the pediatric system, where often family input is a very important and vital part of that, compared to the adult system, where that's obviously still valued, but there is naturally more of an emphasis on the adult individual patient in front of them. And so obviously as a healthcare provider, the healthcare system transition is a big one, but there's actually a lot more else going on for all young adults around this age of sort of 18 as they head to the rest of their lives. And frankly, these bits are possibly even more important and more stressful. Young people around this age of 18 are typically moving on to different parts of their life. If it's school, if they're going to college or university, that's a big shift, possibly in geography, certainly in expectations, certainly in terms of stressors. If young people either around this time or after school are heading off to work, their vocational planning, entering the workforce, that's a big step for a young person and comes with its own stressors and having to balance all of that. And let's not forget that these young people are also entering their lives as young adults, which is what we want. We want them to enter adulthood and thrive. And with that comes lots of exciting moments for them, developing new social networks, maybe finding some life partners, hopefully having lots of fun. As they increase in age, there's also an increased engagement with things, for example, like drinking or other substances. These are all things that are part of young adulthood in life. But all of these bits there's a lot for young people to have on their plates that they're juggling, whether or not they have a chronic disease. But if you imagine all the things that young people are juggling and add on to that all the responsibility of caring for their health, attending health appointments, having that suddenly switch from a whole different center or maybe a whole different team, these are a lot of things for young people to be balancing. And these are parts of why we really think about the time of transition as being a time where health sometimes has some more risks than before. So what are these increased health risks that I'm mentioning? One of them is that with increasing age, unfortunately, in sickle cell disease, we do know that there tend to be some more complications of the disease itself. And so that can sometimes lead to some more need for healthcare, whether that's needing to head to the emergency room for any acute episodes of pain or infections, or whether needing to be admitted for any other complications. Some of these pieces can change and increase with time. As young people head into the adult system, are also older themselves and tend to take on more responsibility for their own healthcare, young people may find that, as you all know, navigating the healthcare system itself can be quite a challenge. Figuring out where the appointments are, figuring out where they might be, keeping track of a long list of appointments and tests and other responsibilities. Unfortunately, do know that at the time of transition, young people sometimes do tend to miss more clinic appointments than when they were younger, and perhaps lots of this coordination was really spearheaded by perhaps an adult family member. And so being able to head to those important appointments to keep up routine healthcare and surveillance and tests to do the same, often those things fall by the wayside when young adults again are balancing lots of things on their plates. Young adults are often switching into a mode of managing their health independently, and just like navigating the healthcare system, this can be a bit different for a young adult than when they were supported a bit more by family, if that was how they used to support their health. And so we do know that, for example, important tasks like remembering to take important medications such as hydroxyurea, that can be challenging when young adults have big switches to their independence, but also have big, exciting but big stressors in their lives as well. Unfortunately, these are not just hypothetical risks of health challenges that we know occur during transition. We do have data that shows that the health of young people around the time of transition is often more at risk than when they're younger. So this is from a study that was published just at the end of last year, which looked at the mortality rate in people living with sickle cell disease. So on the bottom there, you have age going from 0 up until older age. And then on the y-axis there going up, you have the mortality rate. So higher is a higher mortality rate, that's worse. And as you can see, hopefully you can see my arrow there. In about childhood, fortunately, that mortality rate is on the lower side, and that is thanks to, in the last couple of decades, some changes that have allowed us to improve the health of young children and adolescents with sickle cell disease. But you can see a sharp increase in the mortality rate around this age, from that 19-year zone to the 20 to 24-year zone, and that corresponds sharply with transition. The different colors of these lines are just data from different time points, and you can see that sharp increase is unfortunately sustained over time. And so we understand some of the factors that lead to this, and unfortunately, this is still a big change of time that we know that unfortunately the health of young people with sickle cell disease can often be at risk. We've spoken a little bit already about some of the factors that lead to these challenges in healthcare and health management and health overall. One of them, as I've alluded to, is really at least our focus from the clinic side is thinking about different locations for healthcare. And this looks a little bit different in the different centers across our province and our country. But fundamentally, the change from pediatric to adult care changes. Sometimes the core hemoglobinopathy program may change itself, whether it's a different clinic in the same hospital, whether it's even a different hospital across the street in the same center, in the same city, or even accepting the fact that sometimes the core hemoglobinopathy program, whether or not it changes physical space, other sites of important medical care like emergency rooms, those suddenly switch from often pediatric emergency rooms to then adult emergency rooms. So lots of changes in where the sites of care are happening for young people. If young people choose to move for school, move for work, that also then changes important parts of their care and where they know how to access it. And depending on where life takes these young people, the comfort and familiarity with the care of people with sickle cell disease can be a bit variable in different locations. And so if young people's lives bring them to new areas, they may be experiencing different levels of familiarity with how they respond to very common complications like pain. Around this time for young people, there's also a shift in the role of the family, which is developmentally appropriate for young people as they embrace more independence in their life and more autonomy in their own life and in their own care. Um, but as we've sort of mentioned before, whereas when children are not children, sorry, when young people are children, maybe adolescents, they may be more used to having adult family support in booking subsequent appointments and tests and making sure that those are being attended to, as well as the tasks of taking medications, which is not just taking medication, but is actually remembering to pick up the prescription, remembering to fill the refill, remembering to take it every day. These tasks, which used to have often some more adult support, when young people are growing up and taking more responsibility for it, sometimes losing that adult family support can change how well supported the young people feel and being able to tackle all these tasks. And certainly when they come on all at once, that is hard for anyone to take. And so we do see some decreases in being able to attend appointments and tests more regularly, and some challenges remembering to take medications more regularly as well. Certainly, everything we've alluded to in terms of how young people manage their health, this is all deeply affected by their physical health as well. So we know that sickle cell disease can have some impacts on neurocognitive function depending on the level of the disease severity. And so if young people are having impacts on their executive function, and organization, certainly all these challenging bits and putting them all together can be even more difficult. Some other issues that are maybe not transition specific, but come up around this time where young people are thinking about their futures and their lives. One of them is we've talked about going to appointments and tests and taking medications. One piece that we tend to focus on when young people or children and adolescents is really making sure vaccines are up to date. Sometimes that's a little bit less front of mind in young adults and into older adulthood, but is actually still very important in terms of making sure some important vaccinations have regular boosters every couple of years. So just one topic to kind of flag there. And then the other, of course, is young people as they're growing up, they may be thinking about their own plans. Some may be having some thoughts around planning to have their own family. And it's just an important time to be aware that these questions come up and for young people to be educated on what does it mean as a person living with sickle cell disease to have children and what the likelihood of their children having sickle cell disease would be. And so just for them to be well educated and informed about all of that. So then the big question, as we've talked about how important this transition period is and how it can really impact the care of young people, how do we plan for it? There are a few different sources of key principles, and there's no one right way to do it. I've just listed, really, it's not an exhaustive list of some different groups which publish some good principles and components around transitioning young people with chronic diseases, including sickle disease, from pediatric to adult care. I'm going to present a bit later some key elements which I've picked from one, but just to say that it's an important topic that is really the emphasis and focus of a lot of different healthcare groups. As I've alluded to, with different centers and different individuals, every plan is going to look different as well. So the healthcare, even in hemoglobinopathy programs, can look different center to center. Some have lifespan programs where there may not even be movement between clinics. Some there's a bit of movement within the same hospital. Others you're moving from entirely one hospital to an entirely different hospital with totally different teams. And so how you plan for a transition is going to look different depending on what your setting and context looks like. It's not going to be a one size fits all because every center is different and every person is different and their needs are going to have to be adjusted. Often there may be in teams someone who has a role which could have a variety of different names. Often they're termed, there can be a team member termed a transition navigator. Sometimes they have role names like a clinical navigator. Regardless of what that name might be, there often is someone, whether they're a specific role or whether they're embedded in the core healthcare team already, who, among other tasks, one of their focus is going to be working with young people around that age of young adolescence. So maybe age 12 or so through to age 18, but even beyond, to really focus on this process of transition, making sure young people are ready for those changes. So there's no one right way to do it. I've picked some key principles that were just outlined by the Canadian Pediatric Society, just because I thought they encapsulated some core principles well. But the first of their four key principles, their first one, which is really important, is to start transition planning early. So in most clinics, we all start this conversation quite early, often around the time that a young person is a young adolescent, maybe age 12 or 13. You'll see that the conversations start to prepare young people and their families for what it means to enter an adult healthcare system, take more responsibility themselves. So it's not something that we wait till the age of 18 and then we realize, oh, it's time to go to an adult program. Let's talk about it all at once. It's something that we all strive to start quite early to make sure that once we hit that age of 18 and beyond, that there's been lots and lots of planning and support for it. The second principle is to create an individualized transition plan. So every person is different. Their plans for themselves are different. Their needs are different. Some people have strengths and challenges in some areas that are not the same for other people. And so really honing in on, is someone needing some more support in self-management? Is someone needing some more support in health education? For another individual, are those pieces pretty good for them, but do they need some more support just around educational and vocational planning? So just making sure that whatever someone needs and whatever their family needs, that plans are tailored to them specifically. The third principle is to provide support before transition. So really, as I've alluded to, it's not just a one-stop shop and one talk and that's it. Really well in advance, there's a bit of a stepwise approach to bringing up these topics. It may seem actually quite repetitive that we talk in clinic about wanting to engage young people more in their care, but it does take some time to acclimatize to it. Young people have been hopefully connected with the healthcare system since they were very young and often are very used to having adults maybe do some more talking for them, do some more planning for them. And around this young adolescent age, you'll see that clinics will try to shift to help young people practice in a stepwise way, being more independent with their care. So this may look like having young people see healthcare teams by themselves, just try and mimic what's going to happen when they're adults. It may look like trying to encourage young people to be able to speak up for themselves about, well, what is the disease that I have? What are the medications that I'm on? What are the dosages that I'm taking? What are my needs? What are the concerns that I wanted to bring up today? Really trying to develop that familiarity with being able to be educated and advocate for oneself before having to necessarily do that alone in the adult system. And so really lots of practice ahead of time, well before that specific transfer point to adult care. And then the fourth point is really important, which is ensuring ongoing support after transition to adult care. When that transfer of care happens, we don't consider the process complete. We know that, in fact, once that transfer occurs, there's still a lot of acclimatization to new spaces, roles, team members. And so many transition programs, whether it's a specific person or whether there are programs in place, try to work to make sure that there's still some touch points for young people once they transition to adult care to check in on all the pieces that they've been prepared for in the pediatric system. So again, it's not just you're 18, you move and then you're done. It really is a process that, as you can see, starts really early, trying to develop young people's skills to prepare to transition to adult care. And even once they've done that, to really make sure that that transition is going well, that they are comfortable with where their care is housed, where they need to go if there are any emergency episodes, as well as support for all the other pieces going on in their life. So I've mentioned already some of those key topics that we talk about, preparing young people to talk to individuals. We consider them broadly under the umbrella of sort of self-management skills and health education skills and a person's individual health knowledge and their ability to communicate for themselves and advocate for themselves. We try to support young people in learning how to navigate and interact with the healthcare system, which of course they're so familiar with because they've done that their whole lives, but maybe they haven't actually done that themselves independently. Maybe they've often had an adult do that with them. So obviously they have lots of knowledge of what that looks like, but really learning to do that themselves, learning sort of who to contact to book appointments, who to contact if you need to reschedule an appointment because it doesn't work out for you. Those are skills that, seem quite quite straightforward for people who have done them for a long time, but for young people who are transitioning from being young adolescents into young adults, these are a lot of skills and very difficult to do all at once without some more graduated support. Certainly also trying to encourage people to learn how to manage their own health. So really taking ownership, for example, if they move away for work or school, taking ownership over remembering, for example, how to take their medications, remembering how to keep in track if they've got any appointments coming up. Again, roles that may have been previously led by an adult in their home, but now being led by the young adults themselves a little bit more independently. And so again, finding the right balance of, you know what, even though young people perhaps at age 18 are switching to an adult healthcare system, that doesn't mean that once that happens, they're never allowed to have a family member with them in clinic visits. They're never allowed to have family member support in remembering these pieces. It often, if it makes sense for the young person, makes sense for that adult support maybe to continue on a bit afterwards and to gradually wean that down until a time where the young people feel quite capable of handling it all themselves. And, you know, we've mentioned, and we're so focused on this transition in the healthcare system, but again, these young people, their lives are also changing in really exciting ways. And frankly, sometimes those other plates are more exciting and also more stressful. So whether it's school, whether it's work, there are also pieces that are relevant to living with sickle cell disease that are important for young people to know that there is some support. So for example, when attending school, there often are some accessibility offices or a capacity to implement some accommodations to be able to support young people in attending school, but also attending, for example, important healthcare appointments and making changes to their daily life in a way to keep them as healthy as possible. There's lots of opportunities available for young people in terms of accessing scholarships and grants to be able to, again, support them to go off and live that young adult life that we want them to live. You know, these young adults are balancing so many plates already between school, work, life, growing up, and hopefully having a great time doing all those things. Young people with sickle cell disease are balancing far more plates than others. Our hopes as healthcare teams is to help them at least figure out how to spin them at a rate that's a little more manageable, maybe help them hold on to a plate for a bit, and really balance everything that they've got going on in their lives. So I've spoken a lot, but you know, the key pieces, as I'm sure everyone knows, but just to emphasize that transition is such an important time in the care of young people with sickle cell disease, and it can really significantly impact their life as they go forward into young adulthood and the rest of their lives. And so you'll see it's such it's an early process that starts, and it's a big team effort between the young people themselves, their families, and the healthcare teams to prepare young people to make that transition as successfully as they can. And so lots of programs will have this set in place, but also for any families on the call, you know, you are well encouraged to bring up any questions or concerns early. All teams always for sure want to talk about this, and we'll make space to talk about it to see how we can all work together to support young people in this transition as much as possible. So thanks so much for listening, and really happy to take any questions, and also looking forward to the other talks later today. Thank you.
Thank you so much for that presentation, Dr. Liu. It was very informative and it raised really the importance of making sure that we start that transition process to help individuals with sickle cell disease move from, pediatric care to adult care so that it's not an abrupt change in their lives. And we know that, as you mentioned, it can be a lot going on. They have a lot to juggle. So really having that system around them to help them make that transition and help them understand the importance of certain procedures and so forth is something that we need to do as a community. So thank you so much for that. We're now going to move to our next presenter, Dr. Lance Archer. As I said, he's a clinical psychologist, but he's also an individual living with sickle cell disease. So I look forward to his perspective and presentation. Dr. Archer, can you share, if you have slides, you can share them.
All right. Good day, everyone. Thanks again for this opportunity to share on a topic that's also very important to me because of my own lived experience navigating the transition. I would like to put my slide up. Is everyone still seeing my screen okay?
Yes.
Great. I'm going to go over into presenter view, and we're still seeing it okay, correct?
No, it went back to
No?
oh yes, yes, we're saying it. Yes.
Okay, it's good. Okay, great. Um, yeah, so again, thanks for this opportunity, and I will start with just introducing myself, speaking from the position of living with sickle cell disease. I'm Jamaican and I enjoy going to the beach. I love movies. I love to travel. I also love to do research. And of course, I can't go without my French fries. I feel like that's one of the favorite things in the whole wide world. I was diagnosed with sickle cell disease at age 3 months, really. Had a lot of crying spells, and my mother in particular was curious about what's been going on. So, after many trips to the doctor and running some tests, it was confirmed that I have sickle cell disease. I think one of the first telltale signs was just having dactylitis. I was diagnosed with that also, where the joints of my fingers were quite swollen. So it led to this diagnosis. And then over the years, I had a lot of hospitalizations. I needed to do surgery. I think my first surgery was done when I was 18 in college. And over the years, I've developed some degree of deafness because of the condition. I want to say that perhaps navigating transitions, that would have been the hardest part of living with sickle cell disease. Yes, the pain comes, it goes, but then what tends to stand out the most for me is figuring life out while living with chronic pain, while having acute chest syndrome, while having to um, recover from surgeries. And so there were points in life where it felt significantly stressful. I want to say then that my main stressors would have been from high school to post-secondary studies, from post-secondary study to gainful employment, and then when I migrated from Jamaica to Canada. As part of my story is just having really strong support growing up. So when my doctor's appointments needed to be taken care of, my mother in particular would always be there. She would be the one to manage my health from an early stage. And one of the things that I credit her for is her flexibility because I'm not always someone to eat nutritiously. So she would find some creative ways to present fruits and vegetables for me so that I could be able to have those important vitamins and nutrients in my diet. And then I turned 17 and it was time for me to go off to college, and all of that just went through the window. There wasn't sufficient time being spent making sure I'm eating well. And then the rigors that comes with academic studies at the higher level took a toll. And then even just navigating the space, I moved from my hometown to 4 hours away. So there was a lot of independence that was suddenly thrust upon me at the tender age of 17. And so because of that, I experienced a lot of flare-ups, recurring pain episodes. There was a point in my first year when I had to leave school for 6 weeks, really, because I just could not maintain wellness in that time frame. And so I had to go back home, and it was so bad that professor saw that he's missing too much, so he shouldn't even return. And my mom had to come, and we had to do some intervention stuff. It was a very rough period, to say the least. And it was usually difficult because of the difficulty in stabilizing health. And it makes sense. Health was harder to be stabilized because there was so much going on, and I was stressed by that experience. Nevertheless, I made it through my first year. I made it through my second year, which was when I did my first hip surgery. I was diagnosed with avascular necrosis, and they needed to do some sort of remedial intervention before the hip started to collapse. And so that took me out of school again. And then after that, I was able to go back to school, get what needed to be gotten. And then from there, I moved on to gainful employment, which brought on another degree of stress because now I'm in a work environment. I have a supervisor who is seemingly unsympathetic. He did not seem to have the compassion needed to support me in just navigating the world of work while living with sickle cell disease. There were moments I called to say that, I'm at the doctor, I'm not feeling well. And his reaction was he's given me until 11 a.m. to come into work. And so that sort of pressure too made it difficult to maintain wellness. And here I am, just fresh out of college, so grateful for this opportunity, wanting to prove myself, wanting to show up, but didn't know how to show up in a way that honored my health, but also being productive. And so over time, it took a toll, and I started to miss work. Um, I needed to make up for missing work. So I would leave the ER like 5 a.m. in the morning and get to work for 9 a.m. because I just felt like there was a lot of pressure to be there. But little did I know that this was only making matters worse. So no sooner than I arrive at work, than I soon started to not feel well. And then I have to leave early. And then I got sick again. Things eventually stabilized over the years working there because I had shifted departments, and then this shift came with more empathic supervisors, and so they were able to facilitate working with sickle cell disease. So much so, I've had a supervisor who would take me to the doctor's office or to the hospital, really, clinic is what I'll call it. She would take me to the clinic because she understood that I was not feeling well. So having the right support definitely helped when I was in this new department. And it helped me to just be able to become a little bit more stable in navigating the world of work while managing sickle cell disease. And then I moved to Canada, and within 48 hours of landing, I was hospitalized because of the crisis I was having. There was something different about this shift for me. My crisis felt so much more intense. They were lasting longer. Um, I've had really long hospital stays, which was uncommon for me growing up as a child. And I started to have a lot of health issues, organ damage. So my hips got worse, and my gallbladder was severely impacted, and so it needed to be removed. All of this happened in the first few months of migrating to Canada. I say all of that to say that stress comes with transitions. Transitions in general are stressful for anyone. If you think about people who are healthy and not living with a chronic health condition, they will tell you that navigating specific life changes can be really stressful. And so imagine having to live with sickle cell disease. It's coming with an exorbitant amount of stress. And for that reason, the more support we have, the greater our chances of success. I want to say that one of the things that interferes with successfully transitioning while living with sickle cell disease is that for many individuals living with sickle cell disease, moving from high school to post-secondary is complicated by underlying cognitive deficiencies. When we talk about cognitive dysfunction, we're referring to difficulties in thinking, difficulties in learning, difficulties in memory. And all of this we know come from the experience of stroke. Some persons may have overt stroke or even silent stroke. But in general, we understand that sickle cell disease carries with it a lack of blood flow. And blood is what carries nutrients, oxygen to different part of the brain. And if we are not getting sufficient supply, it is possible that there will lead to some neurocognitive complication. Research even tells us that persistent sickle cell pain has a way of just altering the way the brain functions, the way that the certain connectivity that's necessary in the brain becomes impacted by persistent sickle cell pain. And this manifests in the form of what we call decreased executive functioning. Executive functioning refers to specific skills that we need to help us to regulate our behavior, knowing when to stop certain behavior, knowing when to control our emotions, or how to control our emotions rather, knowing how to plan, how to organize, and how to carry out certain tasks. Um, Persistent pain also affects working memory, right? Working memory in this sense is holding certain information in our mind so that we can carry out a task. So say, for example, that we plan that after work, we're going to the pharmacy to get our medication, then we're going to pick up dinner, and then we are going to give our mom or dad a call. Working memory is keeping all of those things in mind so that we can carry it out. But if there are cognitive challenges with working memory, we might forget step one or step two. And then we have research that tells us that processing speed, how quickly and how effectively we can take in information and make sense of that information, it becomes impacted by persistent sickle cell pain. And all of these have a way of interfering with academic functioning and to even work output. So I say this to say that for many individuals with sickle cell disease, transitioning from high school to post-secondary, this might be a part of our story. It doesn't mean that we won't be able to get our degree. It just means that by virtue of having to navigate with these sort of challenges, difficulty remembering things, planning and learning and just processing things, that can make the transition even so much harder, which is what I'll talk about soon. And so one of the things that I find to be helpful in just making sure that we're getting through this is knowing when to access psychological assessment, especially for post-secondary studies. We know that after high school comes college or university, and the rigors of those studies have a way has a way of getting to us. It's very stressful. And so if we can be evaluated formally so that we can receive appropriate accommodations, then that can make the journey significantly easier. Accommodations, I've benefited from accommodations, and I think that I am a true champion of figuring out what sort of accommodations you need so that you can get your degree. And so, what is a psychological assessment? Having talked about how, sometimes we have some challenges with thinking and learning, a psychological assessment evaluates our learning style. It helps us to understand how we process information. It helps us to understand our academic strengths and our needs in general, right? Who should get one? Anyone who finds that they are having difficulties with academic achievement, anyone who has challenges with memory, attention, or even just dealing with emotional problems. especially when we think about making the transition from from high school to post-secondary. We may be excelling at the academic level during high school, and then suddenly we find that at the college or the tertiary level, it's a little bit more independent. We don't have people who are on us to remember to submit. We don't get frequent reminders and so forth. And so we find that even though we were strong in high school, we are noticing that it's really, really more challenging for us to achieve. So if we find that we're having these sort of difficulties, it would make sense that we consider getting a psychological assessment because they verify our needs. A psychological assessment can tell us for sure that, okay, Lance, he learns best when this happens, and he's able to thrive when this happens. So it verifies, it confirms how I learn so that the professors can accommodate that. The psychological assessments provide well-fitted recommendations so that we can facilitate the academic adjustment. So for example, in light of some of the challenges that we may have because of working memory or planning and not organizing ourselves very well and difficulty with attention, if we can have some degree of accommodations around that or adjustments to our academics, then it will help us to succeed. Some of these might mean reasonable flexibility with participation and assignment due dates. This is something that was so crucial for me to excel because I've been hospitalized while doing my programs. I've been having crises that I didn't even show up to the hospital for during my assignment deadlines, especially when we're coming to the end of a semester. And so having professors be mindful of the need to be flexible was something that I found extremely helpful. Extra time to process information, going back to what I said earlier, that sickle cell pain, especially when it's chronic, it just shifts the way the brain operates, and we need extra time to process things. If we can have that documented, then it can work wonders for us if we are continuing with our education after high school. Sometimes the nature of pain interferes with my ability to write. And so it might be easier to send a voice note. It might be easier to dictate to my laptop when I have reports to write. And so using computer for note and test taking can also be a reasonable accommodation that we can benefit from if we have any sort of motor or fine motor skills challenges because of our experience with pain and so forth. So I say that to stress the idea that given the nature of how sickle cell can complicate transitions, if we find that we are struggling with memory or any sort of skills required to excel at the academic level, at the post-secondary level, then it will be worthwhile pursuing having a psychological assessment so that we can get the right accommodation to enhance our ability. I want to shift gears a little bit to talk about how there are certain barriers to transition, and being mindful of our barriers can help us to think about facilitators or how can we address these barriers. And I like to think of ourselves as individuals living with sickle cell disease from the biological, the psychological, and even the social domains that make us up. We are not just people who live with pain, but we are people who live in a society with others, and we are people who have emotions as well. And so being able to match what might be getting in the way of transitioning well can be a good way of exercising some good self-management strategies. So we know from a biological perspective that we may experience organ damage. And so this might affect our ability to go into the academic program that we desire or go into the career field that we prefer. And so it's just being mindful of that. Is it that, okay, I have a vascular necrosis, so I started off in teaching, really. And so I remember needing to teach on crutches because of the intensity of pain. And I think about those who may have chosen different career paths that require standing for a long period of time and um, just having to be physical and active and just how that can get in the way of achieving success that we desire when we choose particular careers. But even thinking about from the biological perspective, the same neurocognitive deficits that I mentioned earlier, how those can interfere with our abilities to understand and attend to proper disease management. Sometimes we forget, not because we weren't paying attention or because we are just complacent, but the nature of our brain connectivity and how the brain operates is that we miss things, and that can interfere with the ability for us to be on top of things and to manage the disease well and navigate the health system. Even what Dr. Lu was talking about earlier, like now it's a little bit more challenging because you expect that as an adult it's more patient focused, so a lot of responsibility falls on you. But sometimes with these deficits in reasoning and problem solving, we tend to have some challenges there. From the psychological perspective or even the socio-demographic factors, we know that sometimes experience with depression and anxiety can get in the way of just being able to attend to transitioning well. Um, Perhaps there is a low income or family environment or living condition is not conducive. Parents may have a particular level of education, and that tends to get in the way of things when we have to think about how do I navigate certain things. And this can complicate transitioning, especially when there's a lot of competing factors. Perhaps uh, our job is so demanding that we can't even get time off. I go back to that experience of the supervisor I had who said that he's given me until 11 a.m. to show up to work. There was a lot of pressure around, okay, how do I rest and recover when this guy is telling me that I need to be here? So all of that can interfere with moving from having really good health at the pediatric stage and then transferring over into adulthood. Sometimes our experience in emergency rooms affect how we decide to how we feel about attending to health systems. So it's possible that by virtue of having negative experiences that we are not very trusting of ourselves to manage our illness. And so we just ignore it, we push it aside. Sometimes we don't experience healthcare providers as helpful, and so we are not going to be honest about our experience with pain and so forth. Sometimes we think that it's going to be a waste of time because I was there for 6 hours and they did not even look at me. All of these things affect our confidence, our determination in pursuing health and using health systems. And so over time, we find that going back to what Dr. Lu mentioned about how between 19 and 24, those early adult years, it has the most deaths. And so this experience, negative ER experiences, get in the way of that. Sometimes we struggle with managing ourselves because we never learned the assertiveness skills required to navigate the healthcare system. We don't have the level of advocacy. We don't have the communication skills required to be able to manage ourselves very well. And then, of course, health literacy. However, despite having those barriers, there are certain things we know that can enhance our ability to succeed during transition. The sense of responsibility that we develop and our ability to think critically and to use self-management skills is important to facilitating successful transition. And this could fall under the umbrella of being mature, being motivated, like knowing that this is what you want and pursuing it regardless of the challenges. That was very important for me. It was always important for me to understand why I am pursuing this and sticking to it and not allowing myself to be downcast for too long when I run into some challenges. Positive relationship, having good health care providers, having good support from the healthcare system standpoint works wonders. And so if there's trusting relationship, if you have a high degree of comfort in just being able to talk about things and to ask questions, we understand this to be critical in successfully transitioning. Dr. Lu also mentioned social support. And I think for me, I want to stress the importance of balancing being supportive as a parent and emphasizing independence and self-management. I think for me, it was so great to have a mother who took control and was able to just be very flexible and to prepare my fruits and vegetables in ways that I could tolerate them. That was great. But when I did my first year, it was a wake-up call for both of us. And we needed to navigate that. And so even with her, she needed to learn how to maintain a high degree of support, but also encouraging independence and self-management for me. And so that would have contributed to my ability to navigate the challenges. In terms of self-management, I will say that it's always good to adhere to the treatment that has been prescribed to us. It's easy for us to think that because I'm feeling well today, I don't need my medication. Or because I'm not having these symptoms, I don't need to show up to my hematology appointment or other specialist appointments, especially when we are in a good space and we want to hang out with our friends and we want to hang out with our colleagues after work. And we make certain sacrifices to enjoy life in ways that tend to ignore the importance of adhering to treatment. I think this was a major part of my success, just being committed to following through on what was prescribed, regardless of how I was feeling. And then seeking out opportunities to build self-awareness or self-efficacy. Self-efficacy is just having that confidence that I can do this and I will achieve a specific outcome. Self-efficacy comes by simply having a to-do list, ticking it off, and just being proud of yourself for doing that. It also comes with practice. There's a sense of mastery that we must achieve in order for us to be confident in our abilities. And so perhaps we may not feel like we're the most assertive. Perhaps we feel like we're not very good at communicating. But these are skills and skills developed through practice, right? So self-management involves adhering to treatment, building self-efficacy, but taking care of your mental health. I have never been so downcast, so discouraged than when I transitioned over into adulthood. Childhood, regardless of the pain, the hospitalization, life was great. Like there was nothing that I would undo about that experience. But then the moment I needed to become more independent and I needed to figure life out, it took a toll on my mental health. Imagine feeling that toll and having to make sure that you are submitting your assignments, making sure that you are doing your presentations, making sure that you are accomplishing your tasks set by your boss so that you can keep your job. All of those tend to weigh heavily on mental health. So self-management involves just being able to take care of it. We do this by practicing relaxation strategies and making sure that we are having a more balanced perspective when we look at things. Things are going to discourage us, speaking from experience, but we know that if we are able to think adaptively, then we are able to navigate through challenges. I think one of the biggest lessons I've learned in perspective taking is the idea of being like water. If you think about water flowing down a stream, regardless of the obstacle you place in its path, water finds a way of going either over it, under it, around it, or through it. And so here I am. I have this assignment that I need to submit, and I'm having a pain crisis. Just being able to see that, okay, now is a time to have some flexibility. I need to reach out to my professor and ask for flexibility so that I don't have to deal with that mental load is very good. Thinking that, okay, I plan to finish my degree in 3 years and it's going to take 4 years, doesn't matter. 10 years from now, it will not matter when you got your degree. What's important is that you got your degree and reach out for support. Making sure that we're connecting to student services, getting access to accommodations is key because it is possible that your professor will wake up on the wrong side of the bed and decide that they are not going to exercise leniency, and you have no sort of documentation that this is something that you will need. So make sure that you are connecting to student services so that you can feel supported in that respect. Same is true for HR department at work, making sure that they are aware of your strengths, but also your limitations, and making sure that they are making the appropriate accommodations so that you are able to be at your best. And staying in touch with family and friends so that you are better able to, feel strengthened in times of discouragement. Okay, so I will stop right there and thank you so much for listening. And I will hand over to Dr. Ivy.
Sorry about that. I was on mute and I didn't have my camera showing, so I was saying some things. Wonderful. Thank you so much, Dr. Archer. I learned a lot from your presentation. As a sickle cell patient myself, I've transitioned, but I've learned so much from listening to your presentation. And I think, this is an area that we really have to figure out how we educate those individuals with sickle cell disease about those challenges that they're going to experience from sickle
Yes.
cell disease so that we can make it easier for them to have a really productive life. But the great news is that, you had resources that really helped you with that process. And we know that a lot of the hospitals, so Dr. Lou earlier was talking about things that she works on to help patients. And so now we'll hear from Miss Sarah Rashid, and she's a social worker um, at McMaster's. She's going to give a presentation about her role as a social worker in that process for transitioning. So, Sarah, I'll go ahead and turn it over to you.
Wonderful. Thank you so much. Good morning, everybody, or I guess afternoon now, but good afternoon. Thank you so much, Amy and Lance. Both of those presentations were great and so informative. So thank you. And Lance, I have to agree with you on the French fries. I appreciate that that's on your list of things about you because I certainly agree with that. Okay, I'm just going to pull up my presentation now. And I will put this in presenter mode. Okay, can everybody see my screen okay? Yeah. Okay. Excellent. Yeah. So thank you so much, everybody, for being here. I'm going to be talking about coping with change and sort of everything specific to, yeah, how to kind of cope with these big life changes that happen, and that change being the change of transitioning. So similar to what's already been shared, there might be some overlap to what's already been shared this morning, but certainly excited to kind of get into it with all of you. So I'm bringing a lot of like the patient voice into my presentation. So many of the conversations that I've had with patients. I support our pediatric and adult patient and families. And so lots of times, often we talk about like big emotions and feelings related to the idea of transitioning, whether that be from pediatric to adult care, whether that be from high school to university, college, going from one place of work to another place of work. But some of the similar sort of themes that people have shared are just the feelings of isolation and loneliness, a lot of confusion, not really knowing sort of what's happening. Yes, there's lots of information that's shared in clinic appointments and visits, and you hear a lot about transitions, but when you're actually experiencing it, many patients have shared that it still feels like a very confusing process. That there's a lot of a big sense of being overwhelmed, and it can be scary. And I think I should have also added in here that it's exciting, that a lot of people do share that there is a level of excitement. And so, yeah, I think that just sort of these are some of the main emotions and feelings that a lot of patients have shared with me in terms of, again, that transition from pediatric to adult care, job to job, school to school, whatever that might be. And so some common thoughts and some common questions that often come up are people's worry related to their medical appointments, sick time, and financial support. And so the idea of, am I taking too much time off? Are people going to question me, right? Are my teachers going to believe me? Are my bosses going to believe me? Again, even hearing, the personal stories of what Lance shared, like having those same thoughts during his experience, and similar to what other patients share in our clinic, and just the reality of not always having a supportive workplace, right? And that fear of, if I have to take time off because I'm in hospital or I'm having a crisis or I have another medical appointment that I need to go to, and what that impact is going to be on the patient and family, right? The concern about sick time often comes up for a lot of our patients who are transitioning into different places of work. Or even looking into getting into the workforce, right? The concern of, is this job going to provide me with paid sick time? How am I going to make up that time or how am I going to, be able to pay my rent or my mortgage or put food on my table for my family if I don't have a job that provides me with paid sick time? And, if I'm in hospital during a crisis or something's happening, how am I going to make that up? How am I going to get that test done? How am I going to be able to make up so much of the missed work while I'm in hospital, right? And so all of these, I think, are very real experiences from what patients have shared with me in our clinic, and really thinking about how to navigate these things as, again, people are transitioning into new spaces over time. And so future changes, really thinking about like the piece of, going from, you might have been at the same elementary and middle school or high school for a very long time. You're transitioning into post-secondary. These spaces become bigger as we get older. It feels like we know less and less people in the spaces that we're going into. Organizations get bigger. Our hospital feels like it gets bigger. There's lots of kind of these spaces that can feel very overwhelming because of how big they are and all of the new people that are in these spaces. And so that transition from school to work or school to school or whatever that might be for somebody, really ensuring that there's like, somebody in your place of work or at your new school that you can feel supported by, if maybe a supervisor is not the most supportive person on the team, but is there a colleague that you connect really well with, right? So having to kind of think about navigating all this and living with a complex medical condition, it creates a lot of stress, as we've heard from both presentations so far. The financial support, right? People are potentially receiving children's disability and then going to be maybe transitioning to ODSP as an adult disability. And so what's that going to look like? How much time is that going to take, right? Is there going to be a gap of a period of time where you're not receiving any funds? And what's that going to look like? Is ODSP going to approve you for support in the future? So again, all of these things that are, I think, really important to think about when transitioning, and really specifically with the financial support, really knowing that your care team and the people on your care team can also help you with all of these things in navigating it, right? Medical doctors being available to support you with your paperwork that you might need to be updating or getting ready or getting prepared for, right? And then high school to post-secondary, what does that look like in terms of accommodation offices, right? Again, we get familiar with the spaces that we're in over time. And especially when people find trusting people in these spaces, it's really, really hard to change that. And it's really hard to not know what the future is going to look like. So these are just some common things that often come up in our clinic from patients that I'm supporting, and pieces of information that people share. And so I think it really is connected to also like recognizing the fact that with transition, there is also grief involved in that. And I think sometimes what happens is we kind of, the idea of grief is very much related to this idea of a death. And that's not actually the only time that we grieve. And so grief is also embedded into like all of these big life changes and all of these big unknowns that we can't predict. We aren't sure how they're going to go, right? Our body and our minds actually take us through the same cycle of grief that we would if there was a loss, because there is a loss and there's that change that's happening, right? So kind of going through this of like, the denial stage of not even really being sure that like, is this actually happening? Like, am I turning 18? Am I going to be getting a new job? Right? Followed by big emotions that come along with it, really questioning, like, is this what we want to do? And again, transitions not only from going from pediatric to adult care, but all of these things in our life where things change, right? Job to job, school to school. We might be moving to a different city. Again, the big feelings sort of related to depression and other psychosocial stuff related to mental health, right? And then acceptance, which doesn't necessarily mean that we have to prove the fact that this is going on. It's just that, like, how are we actually going to cope with the fact that these things are happening and changing around us? So I think it's really important to kind of ground the feelings that are happening related, sort of connecting it to the idea of grief, because these are really big changes that people are experiencing. And again, like we've heard so far, like these changes are happening, and we have a layer of a complex medical condition on top of it. So we're also grieving what that looks like. Community resources, so specifically related to big transitions in people's lives that we will kind of connect our patients and families to. So for sure through SCAGO, and having that like peer support connection to other people who have experienced something similar, to be able to connect and share resources that way. Our patients have shared that that's been super helpful for them. Care team within hospitals. So some hospitals have transition coordinators, transition navigators, social workers on teams, like really knowing kind of who your care people are on your team and knowing how they can support you. Again, the medical team, doctors being able to complete, accommodation paperwork, short-term disability paperwork, anything that might be needed through your care team of specifically the medical doctors. School team knowing, really emphasizing. Something I do in our clinic is to really emphasize, like, who are the supportive people at your school right now, and how are those people helping you, and how do those people potentially know people in other spaces where you're going to be going? So how can maybe a guidance counselor or a teacher in your high school really make sure that they can provide you with the resources for wherever post-secondary institution that you're going to? Like, who are those connections that they can also help you make? And your work team, who is a supportive person that you currently work with, right? Who is who is an ally at work that you can go to if you need something? Who are those people currently in your network? And really trying to pull off of how those people can continue to support. And the theme of having family and community and support, I think, has been kind of weaved throughout everyone's presentation today. And I think too, really thinking about community doesn't necessarily just have to mean the family unit. And so who are those other people involved in your life that can help you through these really big next steps? And so something also that often comes up in our clinic is the worry about having to actually disclose a medical condition to a school, to a teacher, to a principal, to an employer, a supervisor, HR, whatever it might be, a colleague, right? This concern of like, if I disclose this is a huge piece of my identity. And what is that going to mean for me? How am I going to be treated, right? How are people going to view me? Those are often things that patients express feeling when they're trying to decide if they're going to disclose their medical condition to a new space and a new group of people or not, especially related to this often comes up when somebody is transitioning into a new job or thinking about getting a job. often comes up in, patients have reached out a lot around, I'm going for a job interview. Is this something that I should disclose? And so I think really grounding yourself in what is going to feel most comfortable and best for you. And at the end of the day, you get to be in control of your own story and what that looks like. And if that's not something that feels comfortable for you, you don't need to feel obligated to do it. If it is something that you want to do, then of course we also encourage that happening. And so just from the perspective of how your medical team can support you through that and how social work can kind of support you through that is knowing that we're able to provide documentation that doesn't necessarily state what your medical condition is. So it doesn't need to say that you have sickle cell. It can say that there's a chronic medical condition. So there's ways that we're able to write notes or fill out paperwork that doesn't specify exactly what your condition is. There are some situations where we do need to specify it, and that's conversations that we will certainly have with patients to really make that clear so they know what information is being shared. And oftentimes in my role, like I'm doing those letters and those notes with our patients themselves. And so everything is always kind of done jointly. And any information that's being shared is certainly at the discretion and kind of the patient is taking the lead on that. And so just knowing that that's an option for you as well, that if you are thinking about getting a job or you're currently maybe wanting to figure out how to navigate this in your place of work or school, that's certainly something that the care teams can help provide support with. And also just really wanting to recognize too that many of our systems in which people are in, whether that be the school system, healthcare system, employment system, there's already a lot of racism, discrimination, lots of things that many of our patients are already experiencing too. And so when we add the layer of a medical condition on top of that, that can feel more isolating and more challenging to navigate too. So just really recognizing that care teams are aware of that and really want to support patients and families through that. And so strategies for some successful habits. So this is sort of related to Hamilton specific for some of this, but again, there's wellness supports that are offered through schools, workplaces. Being able to connect with those wellness supports can sometimes be very helpful. Reaching out to your supports and really making sure that you've got a team of people who are supporting you and helping you navigate these things. These are really big things to try to figure out independently and on individually while people are also dealing with the medical side of things. So really making sure that you are able to connect with your supports as needed. I always tell patients, there's been experiences in their lives where there's been difficult moments that have felt impossible to get through. Most of our patients have had some type of experience that has felt impossible to get through, and they've gotten through it and they've accomplished it. And in the moment, it might have felt like they weren't going to, and they did. So I always encourage our patients to really think back to a time when something felt impossible and they themselves were able to get through that. Because similar to some of the things that Lance has shared, it's helpful to kind of remind our brains of those things in those moments to then help us be able to actually work through it in the future. In the Hamilton Public District School Board, there are Black student excellent coaches who are graduation coaches stationed in many of our schools across the region. And so their role is to really help students who are Black be able to graduate and successfully transition into post-secondary or whatever they hope to do. So that's another resource that's offered. Many of our patients have been connected to these coaches in their home schools and have found that support to be very, very helpful. And even navigating kind of conversations about medical things. This particular, those staff have been really, really helpful for many of our patients. And then there's some government resources as well. There's lots of guides available online in terms of how to navigate transition. Again, some of the stuff online is geared towards actual transition of care, not necessarily transition from work to another place of employment or school to work or whatever that might be. But super helpful resources that can be used as guidelines and templates for sure. And so some skill building supports to kind of leave people with is, again, going back to this idea of What are things in the past that have happened that you've been able to work through, and how can you remind yourself of those things in the moment when you're going through something challenging? Also thinking about previous experiences where there's been, difficult conversations to have with people, or conversations that you've been really worried about having, and that have gone really well for you. And how can you kind of mirror that in your next steps, right? So, for example, if you have to talk to a supervisor about, hey, you know what, maybe things have, and your health have changed very quickly, and you might need to get a transfusion on Friday, but maybe there's a big work meeting happening on Friday. How are you going to navigate that? And so, really thinking about how to have those conversations with, whether that be a school teacher or a staff member or a supervisor. I always encourage people, like, practice having those conversations, see how it feels, like talk in the mirror as though that, whoever you're talking to is there. And part of my role and our care team's role certainly is to help people navigate those conversations as well. So that support is always available. And then things with time management, attendance, engagement. What are some of the coping strategies that you can bring into your workplaces or schools to help with some of your pain, or to help with focusing if you are experiencing pain and you still need to be in those spaces? What are some of the things that you can do? So can you bring, a hot pack to school? Can you bring a big water bottle, keep it on your desk? How can your care team advocate for you to be able to have those things, right? So at McMaster, we're always able to write those letters and to say that, the student needs to require, or the student requires extra bathroom breaks as needed, water on the desk, that at work, the employer or the employee needs to take moments of time away, extra breaks included. So that's certainly something that, again, the care team can really help with. And again, these are oftentimes kind of frequent thoughts that come up in our clinic from patients around, like, how do we navigate those things? And that's where just really being reassured that your support team within your own community, family, friends are there for you, and as is your medical team. I'm just included this quickly, which is something more related to kind of like a therapeutic setting, but looking at like cognitive behavioral therapy, which talks a lot about how our thoughts impact our feelings, which impact our behaviors or our actions. And so also really trying to ground yourselves in things that are, again, going back to this idea of, have I had a thought like this before where I've been really worried about something? How did I feel during that moment? And how did that impact, my overall actions or my behaviors in that moment? And then thinking about, times, going back to this line of, there's been experiences that have been really challenging and really, really hard to navigate. And how did I do that, right? How did I figure out how to navigate that? So kind of like walking through this can sometimes be helpful to just ground yourself in the confidence of having experienced this, and knowing that, yes, the future can be very scary, and these things are very, very real feelings. And you're also going to be able to work through it with your supports and the people around you, and yourself, right? And so I just wanted to share that briefly too. And then just to leave it with, like, these are almost like statements that I want people to be able to kind of remember in those moments, that you can do it, you will do it. It's hard and it will be okay. You can reach out to your supports as needed. There is support available to you. And again, through your care team, through SCAGO, through people in your own community, there's certainly lots of support around you, and recognizing that these are big, big transitions. And so, yeah, really just kind of want to end it on that. And also just going back to the pieces around, it's okay to grieve the familiar things in life that have happened. It's okay to really grieve the fact that maybe you don't want to move schools, or you don't want to have to like start looking for work, right? Those big next steps, it's okay to be grieving what has happened previously. So thank you all so much, and I'm certainly available to take kind of questions, and I'll share my contact information in the chat too. If there's ever something that you want to connect about, or you're trying to figure out how to navigate it, you're more than welcome to reach out. So thank you so much, everybody.
Thank you so much for that wonderful presentation from all of you. We learned a lot about transitioning, the importance of transitioning, and then also that skills building. So thank you, Sarah, for giving that information about the importance of developing those skills to help transition. I'm gonna open it up now for questions. And I see a lot in the chat about, thank you for the presentation. We have one person actually joining us from Abuja, Nigeria. Wow, so thank you so much for joining us, OB Light, and from Nigeria. I know that there's going to be a sickle cell conference in Nigeria happening this week. So we're very happy that you were able to join us. There's also thank yous to Dr. Archer, but I don't see any comments or questions. So first, I'll open it up to the panel. Do you have any questions or comments you want to share? I think I see a raised hand. Oh, I don't see it anymore. Was there anything? Oh, that was me that raised hand. Sorry about that. But does anyone from the panel want to say anything or ask anything? I think so. It looks like Marlene Scott. Let me see if I can unmute you, and then you can ask your question. Okay, Marlene, I believe you should be able to ask your question now.
Okay, are you hearing me?
Yes.
All right, thank you very much, everyone. And I certainly want to thank the presenters. You know, I've learned a lot. But my last speaker, social worker, she spoke about communication amongst other things. And it's more a statement than a question, because when she mentioned transfusion, you know, it clicked like you might suddenly have a transfusion on Friday. And I am a transfusion patient, and I just want to say that it is important to keep the line of communication open. We really do not have to disclose everything to our, you know, workplaces or supervisors, etc. But I'm going to use myself as an example. Like in April, up to April, I was doing like transfusions every 4 weeks. I was going to be off like between May and September, well, May and August, go back to work in September. But when I went for my May transfusion, I was told that the doctors now requested that I start doing it every 3 weeks instead of every 4 weeks. Immediately after I got home, this was the end of the work season, if you want to call it. But I texted my supervisor and I said to her, you know, I told her how the transfusion went. They always want to know. They always try to cheer me up when I'm at work and doing the transfusion. So I took the opportunity to write her to say, did another transfusion? This was what happened. And oh, by the way, the doctors asked that, you know, I start doing it every 3 weeks now instead of every 4 weeks. I did that deliberate because I can be very deliberate. So I did it deliberately because I wanted to ensure that if nothing changes in September, she would have known that I was doing it more frequently now. She would not resume September thinking that, oh, all right, Marilyn has 4 transfusions every 4 weeks. So I kind of like put her on guard. If it remains the same in September, I'll just be reminding her. If not, if something else changes, you know, either way, then I let her know if I get the opportunity before I go back in September to say, oh, this is it, because we stay in touch. So I'm just endorsing that communication is important, you know, and I just really want to say that. But in terms of communication, another thing that I wanted to share, like about 2 years ago, I was traveling. I always travel during the summer. And I was traveling. I remembered at Pearson, I said to one of the officers who were supposed to be searching me before I go through, I said to her, you know what, I have my medication. And I was telling her because at the time I was also given a letter from the doctor and I wanted to make sure that I was documenting it properly on the form. So I kind of like, it's a kind of narcotic, but I'm given permission to travel with it, etc. So they were like, oh, it's okay. You can just record it as medication. But then she asked me, do you have your water with you? I said to her, no, you guys don't want us to go on the plane with, you know, liquid of any sorts. So no, I don't. She was like, okay, you're on medication. You are allowed to take water because how else are you going to take your medication? I'm like, yes. So this was something I was learning and I wanted to share with you guys. But I also tested it last year when I was traveling. So I froze my water and everything, took it to the airport, and I was allowed to get through. So I'm like, oh, because they always in the past they have said, throw it out, you can't go in with it. So I was learning and I was testing, and now I am sharing that because as much as we can communicate, amongst ourselves and with whoever else to make our lives easier, then I would want to say, go for it. Again, thank you guys, and I'm listening.
Wonderful. Thank you so much for those comments, Marlene, and sharing your experience that it is important to communicate to our teachers, to our employers, and to others what we're going through so that they can understand. And in many cases, they want to help us out. So thank you for sharing that. Okay. I don't see any other questions, so I'm gonna ask the question, and Doctor, it's gonna be towards you, Dr. Lou. So I noticed with the graph that you showed earlier, that individuals are doing well with sickle cell disease now. And so when I was born, I have sickle cell disease in the 70s. The life expectancy was 8 to 10 years. Now individuals are living very much longer than that. But you did show in your graph that deaths increase right in that 23, 24 age range. Can you give us any assessment of whether you think it's that individuals stop taking medicine, or the disease gets worse, or what do you think it is that's causing that spike at the in that 19 to 23-year range?
I think the folks who led that study thought it was all the different factors we've spoken about already today that all come together. So they couldn't pinpoint anything specific, but it was everything together. Maybe, the combination of maybe not taking an important medication regularly, maybe missing important health visits for the reasons that we talked about, systems, self-management skills that allow you to check in and prevent complications, maybe missing screening tests, challenges accessing care in the emergency room and admissions, all those other life stressors that are then also probably provoking worse health status, right, with work and school. As everyone mentioned, and certainly as Lance outlined really well. So probably a lot of it all together. And so I think that it's a sobering figure, of course, and not what we like to see. And I think it speaks to why there is such, and deservedly, such a focus on trying to mitigate those factors where we can.
Yeah. Yeah. So true, so true. Because, now we have so many resources to help individuals with sickle cell disease. There's hydroxyurea, there are other therapies that are really emerging to help. And so making sure that patients are aware. I just want to share a little bit about my experience. So, I'm from the United States. I know one of the factors in the US why we would see that is because with the US, not only do you have to transition from pediatric to adult, your insurance status changes. And you go from, okay, I have insurance, I'm on Medicaid, to, oh no, I'm kicked off of Medicaid. And then that kind of limits my ability then to access therapy because I don't have insurance. In Canada, you have like that universal healthcare system. So could Lance, you or Sarah explain, like, what is the experience like, particularly like when it comes to insurance for a person with sickle cell disease?
I'll just say really quickly, you're right.
Yeah.
I was entirely remiss as a Canadian in not mentioning the role of health insurance for sure in the States. Absolutely. So thank you for bringing that up. That I think as a Canadian, and I didn't mention that in mine, but yeah, not as top of mind here, fortunately, though we certainly have our own struggles, and I'll leave the others to speak to it. I know there are some comments as well about young people in that age, and I would agree. I think on top of all the other factors that we've talked about as young people, that is also an age where other things are introduced in their life, stressors, trying new things. They're old enough. Some things like smoking, drinking become legal. There are other, when young people may also be trying and experimenting with other substances. And so this is true for all young adults, whether or not they have sickle cell disease. And certainly those factors can also influence how easily you can keep up with school stresses, work stresses, remembering to take your medications, going to appointments. So absolutely not the only thing, but for young adults everywhere, definitely an important thing to consider.
Yeah, I agree with all of those factors, and even just considering how, we're privileged to be able to have uh, coverage. So for many of these appointments, thinking back to how there's some drug therapies that require blood work, right? And to think that we are able to uh, go and have our blood work done, and just be able to see physicians easily because it's covered by OGIP here in Ontario. And to think that there are many folks who do not have access to that, and that can significantly impact their adherence level for sure.
Mhm. And just to go off of that too, like I think even when we're thinking about the idea of transition from post-secondary to work, for many of our patients who are coming as international students, unless they're able to secure once they get their work permit, they need to secure a job that will say that they are here full-time, working full-time hours on a long-term basis in order for them to then be able to get OHIP coverage. And so I think too, there's one that flip from a student visa to a work permit comes along. That's another transition that has a lot of stressors involved. And so certainly if you're in those types of situations, connecting with the care team to figure out how, we can all kind of work together to best support. But there's certainly, yeah, that piece of the lack of coverage for patients who are coming as international students between, again, flipping from the student visa to when you get your work permit and you secure employment, lots of additional stressors there.
Exactly, exactly. And I know, so Lance, you shared your experience of going from, high school to college, and it was a totally different environment. And I think back to my experience, I was in a high school and, hey, you're in a class with 30 students to move into college. And I was at the university and I remember my first class, it was a chemistry class, and there were like 250 students in the one class. And, so you knew you weren't gonna get that individual attention. You knew you were gonna be all on your own. Do you have any advice for like sickle cell patients that might find themselves, hey, I was in a high school, I knew all of my friends, there was like 20 of us in the class, to now I'm like, what was that like? And are there any like skill building techniques that you want to share?
Yeah, that's a good question because that can be nerve-wracking for sure. I think what I want to say is just having that confidence in yourself to get through it and just stick to a game plan around making sure that I'm taking care of myself and where I can go to for support. Everything about a transition can bring about intimidation in some way. For some folks going to post-secondary, it could be the crowd, it could be the workload, it could be the removal of that support, like you know that your teacher is more compliant or not compliant. I think the word I'm looking for is supportive. And so all of those things are worth considering, but having a game plan about how to get through it can be very helpful.
Yeah. And thinking back to my experience, I was fortunate enough that, at a very early age, I wanted to go into the Air Force. And so I knew I had to study math, had to study science and do well in high school, in order to go. I wanted to go to the Air Force Academy, and that would be very competitive. But what that goal did for me was help me understand that I need to do well in school early on. And so, I often say to young people with sickle cell disease, you can't start planning your future in the 12th grade, right? You have to really start early and start thinking about what you want to do in life. And for me, I know my grandmother would, encourage me to, hey, get it, go into the trades, like be a carpenter or a plumber. But I knew I had so many crises and I just wasn't physically strong enough. So I knew I had to lean on education. So I often tell, people with sickle cell, hey, you got to start early in the ninth grade, thinking about what you want to do for the rest of your life so that you're prepared. If it's to go to college, you have the grades to go to college. If it's to go to a trade school, you have that to happen. So it's not a process that starts in the 12th grade where I start thinking about it. It's not a process that starts when I turn 18 and then, oh, my pediatrician is coming to kick me out. It's something that we have to start earlier on in like at age 12, at age 13, at age 14, really starting to consider our future. But I do want to ask you a question. So, because you mentioned about cognitive ability, and I found out later in life, yeah, I have those silent infarcts which may have, had some impact on my abilities. And I used to say to sickle cell patients, make sure you do well in school so you can go on and get a job that isn't as stressful. Unfortunately, I don't say that anymore because I had one patient I was working with that had an overt stroke. And because of that, they would never be able to achieve academic, well, their ability to achieve academically was hindered. So do you have any advice for like younger students that, what they need to do to make sure that they can succeed academically?
Yeah, I think we all have strengths and needs, right? And for some of us, because of the experience with silent infarct and overstroke, it may interfere with our ability. It's hard to say in what way and how that will affect it, but I think regardless of what happens or condition, we still have strengths and we can always just explore what sort of strengths and how these strengths could fit into a different career path. I wanted to be a dentist and I was not very good at science subjects initially. So I needed to just think more deeply about what is it that would be a good fit, a better fit. And so it is a deterrent in some way, but it is also an opportunity to just exercise some flexibility that if I'm not able to pursue certain academic courses because of my challenges, I will choose to tap into my strengths and just be able to excel there. I also think that support is effective. Like I say that we can learn, but we just may need to learn different than our peers. And so just being able to find out what sort of support can be more compatible with our learning style, then we should be in a better position to excel as well.
Wonderful. Wonderful. Yeah, and I know also with my experience. So when I was younger, I had a lot of crises, and it sounds like the same thing for you, Dr. Archer, that you had a lot of crises that you had to deal with. And I kind of learned how to deal with crises and learn how to deal with my illness. And I guess this question is for all of you, but particularly you, Dr. Lou. I was fortunate enough to be exposed to hydroxyurea in my mid 20s. So with hydroxyurea, for me, it was like a light switch. I went from having 4 to 5 crises a year that I had to deal with to not having any crises. I imagine now that there are quite a few sickle cell patients that have never had a crisis because they've been on hydroxyurea their whole lives, and they may not experience their first crises until they get to their 20s. Have you experienced that, and does it create new challenges for individuals who might not have had any problems with sickle cell disease because of the therapies they're receiving until they get into their 20s and 30s, and then they have to learn how to deal with sickle cell?
You're absolutely right. We are so fortunate now to have hydroxyurea for individuals hemoglobin SS and S beta 0. We encourage starting that as young as 9 months. And as you mentioned, we are fortunate now to meet many young people where that's part of their life from early on. They are going through childhood and when they're taking it regularly and having a good response to it. Some of them really are coming to our clinics every so often saying, not much to report, which is also great to hear, right? But you're absolutely right then. It's still important to embark on the education around, well, okay, glad you're doing great now, but what do you do if something comes up? Because as you mentioned, those stressors change as you're older. Maybe when you're busy in school and work, you're not quite as able to stay hydrated, to stay rested. You've got all these other stressors going on. It may not be as easy to keep away the triggers that might otherwise trigger some pain episodes. And so I think it's so worse. Obviously, it's incredible to see this change. And also we start this medication, as you know, for individuals with hemoglobin SC and S beta plus as well, early on as well. We've seen the same excellent response. And that's why I had mentioned, luckily, that bar line of mortality is quite low in young people now, really due to some of these recent advances in care. But life always brings its own challenges. And so it is so important to make sure that young people know how to navigate that healthcare system to keep taking care of their healthcare.
Yeah. And so, Sarah, have you seen any situations where patients, do extremely well in those first few years of life? They say, "Oh, well, hey, sickle cell, it's not a big problem." But then when they hit those transition years, they start experiencing more problems.
Yeah, for sure. And I think something that our clinic is really trying to do is figure out sort of like those teen years. What can we do to like help support with whether that be like a medication pack so that you've got, all of your meds are sort of ready to go. You can fill it up on a weekly schedule so that you have everything sort of accessible for you. So really trying to work with a lot of our youth around like what works for you, what doesn't work for you, how can we try to make this sort of as like simple and flow with the current routine that you have. So yeah, we notice that sort of around those teen years, things change a lot for people, and even like with people in certain jobs, right? Like when work schedules, if somebody is doing shift work or whatever it might look like. And so really trying our clinic really is trying to work very closely with our patients to figure out like how can we get creative with what taking like with what it might look like in how you take your meds. So yes, we are trying to work on that, and certainly is built into our transition plan that we are sort of in the works of redoing and looking at and how to make it better for people. So
Wonderful, wonderful. Okay. Yeah, and I often say to, people that, hey, with sickle cell disease, we have to transition, of course, with our healthcare, but we also have to transition in those other ways with school and going to work and there's a band that I liked when I was younger, the New Edition. I don't know if that might be beyond your years. They came out with the song though in 1988 called Boys to Men, and the verse says, these are the things that change boys to men. And so we have to think about not just with our sickle cell disease, but what are those other factors that change us from boys to men that we have to consider. And that includes looking out for ourselves, figuring out the job situation. My situation was a little different in that I had a mother who had a mental illness. She had schizophrenia. She could be there for me in the best way that she could, but there wasn't as much support. So I kind of had to learn, some things on my own and say, hey, I got to figure it out because, and I came from a very poor background. And so it was like, if you don't figure it out, then what are you going to do? And so we really have to make sure our sickle cell population is aware, not just of, hey, you got to do this to take care of your sickle cell, but you also have to figure out, what do you want to do with the rest of your life once you hit that? And it was mentioned by someone in the chat that it is a time when we want to explore new things, we want to experience new things. We might be tempted to drink with the fellas or run around and do other things, because we're, hey, sickle cell patients, but we're still, men and women, and we still want to experience those things. But it's important to recognize that if we do certain things, like drink, hey, we can become dehydrated, and that can create problems with us. If we're running around and not staying warm enough, we can get those joint pains and so forth. And if we're not taking our medications consistently, whether it's hydroxyurea or other medications, then we can end up in a situation. So, okay, we're coming to the end. Are there any other comments that the panel wants to make? Any last messages that you want to give to the audience? Okay, I guess I'll go ahead and then just say that, I want to thank everyone for attending this session. Transition is a very important period, and we have to make sure that we're educating our patients that it's not a one-time event. It's an event that's going to take time, and it's an event that we have to start preparing early for. As I mentioned, with my particular situation, I didn't see a pediatrician or have a sickle cell doctor when I was coming through. And so I kind of had to learn how to talk to the doctor, how to negotiate my health care. And I think those are skills that we have to give to our youth with sickle cell disease to help them learn how to negotiate their health care. My experience has been that it does become more of a negotiation when you become an adult. I didn't go to a children's hospital, so I didn't have the cute things. But I still, when I visit my doctors or I go to the emergency room, it's a negotiation, and I have to make sure that I leave that negotiation with what I need to be healthy and to be strong. And sometimes, you have a partner, Dr. Archer said, that would be more receptive to hearing what you have to say. But then there are going to be times when you may have a partner that you're negotiating with that doesn't want to hear what you're talking about. That isn't as receptive to what you're telling them. So we have to teach our young people how to do that in multiple settings. And then we also have to recognize that, our young individuals with sickle cell disease, we may not be there to help them. They may move to a different state, a different province. They may move to, different cities. And so we have to give them the skills so that they can be responsible and able to move forward with negotiating those pitfalls in life. But making sure that we inform them that we're there to help as well, that we're a phone call away, or that we can be there for them in the process as well.
Thank you so much. And I'm sorry, I don't know if I think it just came to me directly, but there's just a Q&A. Can I just answer it quickly if that's okay?
Yes. Oh, yeah,
Okay.
definitely. And you can take your time on it. We still have some time.
Okay. Thank you. So the question was just around age-specific strategies for managing school or work transition for adolescents versus adulthood with sickle cell while going through all of these same stressors. So thank you to whoever asked this question. I think age-specific strategies for managing school or work transition for adolescents is really about meeting them where they're at, recognizing that is a big transition, and they also have like adolescent development, which means many things. And so really trying to kind of connect with them where they're at, seeing like allowing them to really, I mean, allowing everybody to really take the lead, but I think fostering that sense of independence around what they feel like they need for themselves. I even think about sort of medication routine, specifically with our adolescents versus adults. Many of our youth are like super into like skincare and like taking their time in the mornings and doing all these things. So I incorporate their medication into their skincare routine. So it's things like that where it's just again kind of meeting them where they're at and what their needs are. And then age specific for adults who are living with sickle cell and also going through these same stressors. Again, I think the foundation of really meeting somebody where they're at. I know these aren't necessarily specific strategies that I'm providing, but really thinking about what are the priorities in somebody's life in adulthood versus adolescence, and how can you kind of build off of those specific things that are most important in their lives at that time to help with a smooth transition. And that's where I think too the peer support can be so helpful, because the decisions that are made in adolescent oftentimes impact adulthood. And so are there people who can speak to that experience of, as an adolescent, this is what I did, that might help to be able to kind of influence and vice versa with that. So yeah, I'll leave it at that for that question. So thank you to whoever asked that. And I hope that answered it.
Wonderful. Uh, um, and I just add to that you're looking at the lifespan. We have to consider arming our individuals with sickle cell disease, and that might be even like I remember you know during camp for individuals with sickle cell disease, we would have to let the family know and let the child know that, hey, bedwetting could be a problem because individuals with sickle cell disease may have problems concentrating their urine, so they may be prone to bedwetting, and so helping them adjust to that. As you get older, you have to start going to other doctors as well as your hematologist. So making sure that, hey, I have that nephrologist that's going to help me with my kidney function as I get older. I might have that neuropsychologist, to Dr. Archer's point, that's going to help me because I have silent infarcts, and or as I age, there may be other problems with my joints that I then might need to see orthopedics or other doctors. And so helping our sickle cell patients understand that as we age, there may be circumstances. And one thing about sickle cell disease is that it is so um, variable for different patients. There are some patients that hey, they may have that silent infarct, but they never have any problems with their kidneys. Or hey, they may have leg ulcers, but they never experience other problems. And so making sure that we're explaining that whole gamut of circumstances that can arise in sickle cell disease. Wonderful. So we're at time. I want to thank all of you again. Thank you, Dr. Liu. Thank you, Dr. Archer, and thank you, Rashida, Ms. Rashid, for joining this session today and helping us to meet the community where they are, explaining to them concepts that we really need to get to our community members so that they can live the best life possible. So I want to thank you so much, and I look forward to continuing to work with you in the future.
Thank you so
Absolutely.
much.
Thanks for having me.
Thank you so much, everyone. Have a nice
Take
rest of your
care,
weekend.
everyone.
Have a great
Thank
day.
you, everyone.
Bye.
Have a nice day.